Hello everyone, I'm Dr. Kritika Devi. I'm a consultant at Nova IVF Fertility, Chennai. Today I want to take this opportunity to share with you or to give you inputs about what is azoospermia and what are the options available for men with azoospermia to father their own genetic child. So most commonly what I see is more than women, men get shattered when they tell they have zero count. They literally equate it to their masculinity and they think if the count is zero, they cannot even have a normal family life. Please understand, both are totally different. A man can have zero sperm count but still can have a normal sexual life. Same way, a man can have zero count but still can father his own genetic child. So what are the options available for them? So if the count is nil, there can be two reasons why that particular male is not able to have his sperms. One, it could be a problem with the production at the testicular level. So we call it as production problem or non-obstructive azoospermia. The next reason could be he may be producing the sperms, but there could be a blockage in the reproductive tract. See, probably a block in the vas deferens or a block in the seminiferous tubules because of some infection that the sperm produced cannot come out. So these are the two reasons why a man can have a zero count. So among the two categories, the man who has a problem due to obstruction has got a very good results with say a surgical extraction. All we have to do is just put in a needle into his testis, take out a small bit of testicular tissue, see under microscopy whether he has sperms, and then utilize the sperms to fuse with the wife's eggs to create embryos and then transfer into the wife's uterus. So this category of people will have a very good success rate. We have almost around 60 to 70% of men with obstructive azoospermia having their own genetic child. So the other category, non-obstructive azoospermia, the problem could be genetically there can be a problem with the production of sperms itself. So the success rates with this group of men could be low, but still there are some women there can be patchy areas of sperm productions in the testes. So we can map those areas, and when we take out that particular area where there is a sperm production and if we can isolate few sperms, we can still use it to create their own genetic child. So remember, nil count doesn't mean nil chance. There are always ways and means available. Don't lose heart. Keep fighting. We are there to help you. Thank you.